All right, so I wanted to talk about our right angle driver, some little tips and tricks. This is one of my favorite instruments. You know, we all have certain instruments that, you know, we feel we can't live without. And certainly this hand driver is an instrument that I can't live without. It comes actually with two different attachments into the contra-angle attachment. This is your regular driver, and then it also comes with a torque adapter. I'm going to show you the regular driver. There's a couple really cool things. Number one is that it really tends to grab on nicely to healing abutments and hold them steady. A healing abutment's much more difficult to deal with when you have it on a hand driver and you're trying to get back, especially in a posterior area of the mouth. And not only do you have space issues, but then you have to stabilize the healing abutment, and then you have to turn the hand driver. Whereas with the right angle driver, once you get it in place in the mouth, then the turning is happening from outside the mouth. So all you're doing is stabilizing the head of the handpiece. The other thing which is really cool is that, again, when you have limited space, it's often difficult to get the orientation of the healing abutment, and you know there's always the potential that you can cross thread or not be able to get it in the right position. Well, the really awesome thing with the right angle driver is that once you get it into your implant site, and then you're stabilizing it by putting a finger on top of it, what you do is you rotate it in reverse, and as you rotate it in reverse, you're kind of feeling the line of draw. And then once you're in the right line of draw, when you're going in reverse, you hear a little click, like that little click. We'll do it one more time. Once you hear that click or feel the click, then right from that spot, if you go in the forward direction, you're going to be perfectly in the line of draw. And it's much easier than it is when you're doing it with a hand driver. The other thing that's really nice is that you'll get a sense that when it's not being impeded by the healing abutment is not being impeded by either the tissue or bone, you'll feel like a lockdown as it sits on top of the head of the implant. If you go to tighten it and you're just kind of feeling a slow tightening and you're not feeling like a solid kind of stop, then you know that there's either some tissue or some bone in the way. So from a sensory point of view, you're able to do a lot more things with the hand driver, in addition to requiring only about half the space as you normally would if you had a regular hand driver and you were in there trying to tighten it down.